Welcome to Module 2.6, Detecting and Prioritizing SARS-CoV-2 Variants. This presentation is part of the COVID-19 Genomic Epidemiology Toolkit from CDC's Office of Advanced Molecular Detection. My name is Dr. Shannon Matziger, and I am a Deputy Program Manager with the Colorado Department of Public Health and Environment. This module describes the detection and genome sequencing of SARS-CoV-2 variants to prioritize COVID-19 investigation and contact tracing activities. Be sure to check out the Toolkit's other modules, which include a combination of case studies and training material to help you get started supplementing epidemiology with genome sequencing data. As a PulseNet regional laboratory, the Colorado Department of Public Health and Environment entered the COVID-19 pandemic with established genome sequencing capacity. We had one Oxford nanopore MinION and two Illumina MiSeq instruments. We also had funding from CDC to serve as a regional resource for cloud computing capacity and analysis of genome sequencing data. Our laboratory director, Dr. Emily Travanti, understood that whole genome sequencing would be important to responding to COVID-19 and prepared from the beginning by requesting additional instrumentation, reagents, and staff in the pandemic's response budget. So it seemed we were set up for success. However, we had recently lost our single CDC-funded bioinformatician, and our sequencing staff was pulled into the diagnostic testing effort. This left us with some rebuilding to do, but we were able to hire a new bioinformatician, as well as two additional term-limited bioinformaticians to focus on SARS-CoV-2. Once our diagnostic testing laboratory was operating at full capacity, we were able to begin rebuilding a wet bench staff for SARS-CoV-2 sequencing. We completed our first sequencing run in late August 2020. Initially, we focused on outbreak detection in cases of suspected reinfection within congregate living facilities. Between August and December 2020, these sequencing efforts were made in an attempt to support over 100 investigations. The phylogenetic tree in this slide is based on our CDPHE next-strain build, but you can explore a similar one calculated by CDC Spheres Consortium from public sequencing data via the link at the bottom of the slide. Importantly, sequencing from this time period was not representative of infections statewide because our selection criteria was biased towards congregate living facilities. At the time, we were using sequencing data to investigate outbreaks at these facilities, addressing questions such as, was the virus introduced to this facility once or several times? Or to confirm suspected reinfection cases with questions like, was the resident reinfected with a distinct SARS-CoV-2 viral type, or is the virus shedding from a previous infection? We used information gained from these data to inform infection control recommendations, such as cohorting and contact tracing efforts to improve the response to subsequent outbreaks in similar types of facilities. Then, mid-December 2020, Public Health England reported the spread of an emerging, more transmissible variant of SARS-CoV-2, referred to by its pangoliniage designation as B.1.1.7. It was soon classified as a variant of concern, or VOC, by the World Health Organization and CDC. One of the defining mutations in this variant, which WHO was now calling alpha, is a small deletion in the gene encoding the spike protein. This deletion happens to interfere with the Thermo Fisher TaqPath RT-PCR diagnostic assay's ability to detect the spike gene. This ends up producing a characteristic S gene target failure, also known as SGTF. This plot, taken from the early report on B.1.1.7 in the UK, suggests that SGTF could function as a diagnostic screening tool for B.1.1.7. For additional information on this and other emerging variants of SARS-CoV-2, see Module 1.4 of the Toolkit. CDPHE, along with clinical and commercial laboratories in Colorado, was using the Thermo Fisher TaqPath assay for diagnostic testing. Beginning in December 2020, we started routinely routing all diagnostic samples with SGTF to CDPHE to confirm with sequencing. With these efforts, we identified the first US infection of B.1.1.7 in Colorado later the same month. From December 2020 to January 2021, our sequencing data confirmed that 100% of SGTF specimens that were sequenceable were B.1.1.7. This suggests that, in contrast to other parts of the country, no other viral variants with the same signature were circulating widely in Colorado. We were careful to communicate that SGTF serves as a screening tool and the sequencing was needed to confirm the identification of B.1.1.7. However, given that other lineages, there were no other lineages identified with this signature in Colorado, we felt comfortable reporting the confirmatory RT-PCR results to our epidemiology partners while sequencing was still pending. We found that early communication of SGTF results was very useful in contact tracing and investigation of potential instances of B.1.1.7 transmission. Colorado's detection and investigation of the first U.S. case of B.1.1.7 infection was an example of epidemiology and laboratory coming together to respond quickly to a public health concern. Identification of the index case and containment were swift and effective. This success helped to increase statewide engagement for broader SARS-CoV-2 surveillance. We set up a daily meeting to discuss SARS-CoV-2 variant sequencing results, allowing our epidemiology colleagues to start each day with the most up-to-date laboratory data to support their contact tracing efforts. Here's an example of a B.1.1.7 cluster investigation that was informed by genome sequencing. A commercial laboratory identified a single person with an SGTF test result. Although the specimen was not available for sequencing, case investigation and contact tracing identified additional B.1.1.7 positive cases confirmed by sequencing both within the person's family and among coworkers. CDPHE analyzes SARS-CoV-2 Illumina or Oxford nanopore sequencing data on the GCP Terra platform using the secret or Arctic network pipelines adapted by our bioinformatician, Dr. Barbara Bankers. The phylogenetic tree here displays genetic relatedness, highlighting the cluster of B.1.1.7 sequences recovered from the 10 secondary cases identified through this investigation. The Pango lineage and next strain clade assignments are also indicated to the right of the tree. Looking specifically at the spike gene sequences, we could see that all of them share this characteristic mutations that define B.1.1.7, including the deletion responsible for SGTF. In addition to prioritizing SGTFs for sequencing, we implemented two other approaches to aid detection of emerging variants by improving our surveillance sampling. First, each week we sequence a random sampling of at least 30 positive samples from each participating clinical laboratory within our state sentinel surveillance network. Secondly, we now sequence all positive specimens identified by diagnostic testing that's performed at CDPHE laboratory the previous week. SGTF specimens submitted by other laboratories where confirmation and sequencing are flagged at submission and excluded from surveillance sampling. By April 2021, these sampling strategies allowed for us to increase our sequencing capacity at CDPHE to more than 1,000 samples a week. As mentioned earlier, the CDPHE laboratory still performs SARS-CoV-2 diagnostic testing, mainly for congregate living facilities, from which all positive specimens then get sequenced. These activities led to the identification of the first cluster in Colorado of another variant of concern, or VOC, B.1.3.5.1, which WHO has now named Beta. The first cluster was suspected in the first week of March 2021, when multiple positive specimens collected from the same county were linked to the same facility and were identified as B.1.3.5.1. Acting on this information, CDPHE epidemiologists were able to identify additional related B.1.3.5.1 cases from the outbreak at that facility. The following week, a second cluster was suspected from sequence samples received from a different county, this time among a family. This phylogenetic tree from NextStrain displays those B.1.3.5.1 cases identified by all surveillance samples within the CDPHE laboratory. The first cluster, associated with a congregate living facility, is labeled at the top and includes a number of similar specimens with few mutations apart. The longer branches within this cluster also suggest that cases may have been undersampled from this facility. The sequence data also identified a potential linked case from the community with no known connection to this facility. The second cluster was identified among family members in a separate county. The sequence data suggests that it was not related to the outbreak at that congregate living facility. This tree also includes 4 other epidemiologically unrelated cases with different B.1.3.5.1 sequences showing the difference in within this lineage. Together, this evidence suggests that the VOC was already circulating throughout Colorado beyond the clusters that have been identified. In addition, the facility associated with Cluster 1 responded to detection of B.1.3.5.1 by increasing efforts to quickly vaccinate facility staff and residents. This facility continues to monitor, and no additional cases of B.1.3.5.1 have been identified since March 2021. In the case of Cluster 2, no secondary cases were identified outside of the family unit. We continue to monitor the relative proportions of known variants of concern and variants under investigation identified through sentinel surveillance in Colorado. As explained on previous slides, These frequency calculations exclude specimens selected for sequencing due to 1. Signatures such as SGTF. 2. Identification during investigation of known VOC VOI investigations. Or 3. Special studies conducted by other partners such as CDC. CDC's National Genomics Surveillance Program estimates biweekly proportions of most variants for SARS-CoV-2 lineages in the United States, accessible from the COVID-19 or COVID data tracker via the link at the bottom of the slide. Sequencing at the CDPHE laboratories supports monitoring of SARS-CoV-2 transmission and disease severity. These data improve our situational awareness of efforts to control the spread of emerging variants, such as the VOC B.1.1.7.429, which we highlighted in the May 2021 MMWR article. Looking forward, we hope this data will help us study whether certain variants of concern may be associated with either reinfections or vaccine breakthrough events, a topic that is covered in Toolkit Module 2.5. Finally, as more Coloradans become vaccinated and test positivity rates decrease, we expect that SARS-CoV-2 detection and sequencing for municipal wastewater could help focus testing efforts and inform public health response. As an example of this, see this case study in Module 2.7 to learn how wastewater testing has been used to guide sequencing efforts in Vermont. In summary, sequencing efforts support both national and statewide characterization of SARS-CoV-2 transmission and COVID-19 severity. Here in Colorado, sequencing adds valuable information for case investigation, contact tracing, and outbreak response. Most cases involving SARS-CoV-2 variants of concern identified by sequencing have led to detection and quarantine of additional secondary cases. We've taken a layered approach to prioritizing sequencing of suspected variants based on SGTF, while also monitoring the contribution of targeted random genomic surveillance in our state. This concludes Module 2.6. Part 2 of the toolkit contains case studies that review the use of genomics in response to COVID-19. Please visit the COVID-19 Genomic Epidemiology Toolkit page where you can find more information on this topic, as well as a short survey to provide feedback about this module. On the Toolkit page, you can also subscribe to our mailing list to receive announcements as new modules and material are released. Thank you.